Bill Gates says his foundation has apparently reduced child death, particularly caused by transmitted disease in Africa. His remarks were heard during his attendance in the panel discussion organized to celebrate the 25th year of the foundation under the theme 25 Years of Progress at African Union headquarters in Addis Ababa, Ethiopia's capital. Many officials, invited guests and health professionals from various African countries have attended the panel discussion. Bill Gates says due to steps taken to tackle death, child death has fallen from 9.2% to 4.4% in Africa, pointing out that maternal death in Ethiopia in particular has dramatically fallen by half. He said HIV-related diseases have gone down from 1.3 million to 390,000, especially in sub-Saharan Africa, ever since Gates Foundation started its charity missions in the continent. Malaria and polio have also been big threats for African children, with Mozambique praised for its massive hit back against the former, breaking its influence from 32,000 deaths down to 18,000 deaths.
A particular challenge in Africa was the spread of HIV. The deaths from HIV peaked soon after the turn of the century and have now fallen from the peak by 70%. Again, this was achieved through partnerships. In the early years of the foundation, right after helping to create Gavi, we helped create the Global Fund. And it pools money from Gates Foundation and rich countries to help countries, including those in Africa, fight 3 diseases: HIV, tuberculosis, and malaria. And so it's another great example of solidarity.
Mentioning Togo as a aforementioned country to combat tuberculosis, which also accounts for the death of children in Africa, Bill Gates said efforts have so far been recognizable. He says the introduction of AI will help address the future challenges related to health, but Gates says health issues shouldn't be left out for a certain charity organization.
As Gracia said, it's time for Africans to leverage all the resources at their disposals and take the destiny of their people into their own hands. And, we already see a lot of steps being taken. Nigeria, Tanzania, Malawi, all shifting budget priorities to make sure that basic primary health care, basic medicine treatments are not cut off as much as these aid cuts would otherwise generate. We need to prioritize well. We need to work together, and I do believe we will get back to good progress. I recently made a commitment that my wealth will be given away over the next 20 years.
Deputy Chairperson of the African Union Commission, Salima Malika Haddadi, on the other hand, says building strong healthcare system in Africa should be the contemporary Africa's focus. Recognizing Gates' impact on Africa's health status, she said cooperation among Africans plays a pivotal step in eliminating disease in the continent.
Serving as a powerful reminder that the aspirations of our 1.5 billion people must be matched by tangible progress in their daily lives. This vision is echoed in our Agenda 2063, which continues to guide the priorities of the African Union system. It underscores the need for our collective sustained commitment to ensure food sovereignty and climate resilience, to strengthen health systems and pandemic preparedness, to empower our youth through education and innovation, and to fully recognize and support the essential contribution of women to the continent's development.
The Gates Foundation is an American private foundation founded by Bill Gates and Melinda French Gates, launched in 2000, and is the 3rd largest charitable foundation in the world, holding $77.2 billion asset.